Pharmacists are in a unique area of our evolution right now. Right now we have a even split between a lot of the operational or the distribution types of activities that we do. In other words, making sure that patients are on correct medication and making sure medication gets to the floor. But we're also at an area where we have significant inroads with regards to optimizing patient care through having pharmacists available at the bedside or near the bedside, working collaboratively with physicians and nurses. As we begin to move forward, we need to see that balance continue to shift so we can spend even a greater percentage of time being able to utilize our knowledge and expertise of medication and within our scope of practice to be able to further optimize patient care.
With healthcare reform, there's a lot of challenges we're going to be faced with, but I think these challenges can be opportunities for pharmacists. I think we're all trying to figure out what our role is going to be in the accountable care organizations and how we can help with medication therapy management. I think that we've kind of had a passive role in providing clinical services, and I think we'll have to have more of a face-to-face relationship or interaction with patients as we move forward. And what that looks like, I'm not really sure, but I think we have the opportunity right now to really step up and be proactive and create what our roles will be. I think it's all about being more efficient in the pharmacy, which allows us more time to do, allows the pharmacists to do what they should be doing, and maybe increase or bring opportunities to us to increase our services. What I'd like to see probably is pharmacists more involved in taking drug histories upon admission, and then hopefully be involved in, talking to the patient at discharge.
Pharmacy has been a great profession over the last decades that I've been involved in the profession. And in Minnesota, we've been fortunate. We've had a real change in our healthcare within healthcare reform in our district or in our region. The Hennepin County Medical Center has been tagged with taking care of about 9,000 patients. It's at a very restricted payment, but it's accountable for all their healthcare expenses. And through the advancement of specialty clinics, but also pharmacy and their involvement in the continuum of care. Our pharmacists have been involved in med reconciliation in the hospital. Continuing our care in the hospital, we make the recommendations to the residents of the right appropriate therapy. But then on discharge, we make sure that the orders are appropriate, and then we follow up with the patients with medication therapy management 2 to 5 days after that. I think that's a model that really will be our future. Pharmacists seeing the patients one-on-one and optimizing their medication therapy. And after the first 5 months of this program, our organization has shown a $1.2 million savings in healthcare expenses compared to those patients not enrolled in this population or this program. So there really is a future. Pharmacists are part of that team. One of our physicians, Dr. John Hitt, made the comment that pharmacists are integral and critical for the success of the program, and I very much believe that.